The anti-vax movement that's shaped so much of the Trump 2.0 era politics may be facing an unexpected setback after the president's own pick to lead the CDC signaled a break from vaccine skepticism. Trump this week nominated Dr. Erika Schwartz to serve as CDC director. Schwartz, a vaccine supporter and former Coast Guard chief medical officer, previously served as deputy surgeon in Trump's first term, where she played a major role in the U.S. response to the COVID-19 pandemic. The real question now is whether Schwartz can restore credibility and scientific independence to the agency, or will it remain constrained by the influence of HHS Secretary Robert F. Kennedy Jr. Meanwhile, Kennedy testified before Congress this week over his vaccine views and his handling of the measles outbreak in several states. Here is how that went.
Do you agree with the majority of doctors that the measles vaccine could have saved that child's life in Texas?
It's possible, certainly. I've always said I'm not anti-vaccine. Right now, I just approved 3 weeks ago $500 million for research on a new cancer vaccine.
Okay, Mr. Secretary, you have been a long-time voice against vaccination. You
no,
I haven't.
No, I'm not anti-vax. I'm pro-science.
And joining us now is Dr. Chris Purnell. She's the director of the NAACP Center for Health Equity. It is great to have you, Dr. Purnell, back here on the show.
Good to be here.
So I guess I'll begin with whether or not you see Dr. Schwartz as a sign of hope, if this signals to you that there really could be a sea change here.
Yeah. So immediately I was encouraged. She has rock solid public health credentials. There is nothing that I think we can see in her work history, in her preparation. She's an actual physician. She's led during the pandemic. She's been in executive roles. Very hopeful, but I'm also vigilant because she is still answering to a boss who is anti-science and who is anti-public health and anti-vaccine.
But, Doctor, what do you make of the politics of the decision to appoint a physician with the actual expertise and scientific thought for this role, given they don't like people who are pro-vaccine in the Trump administration, and others have gotten booted out? So do you think that they're really worried that the anti-vaccine stance could hurt them in the midterms?
You know, I think that's a real possibility, right? This administration is skating on thin ice. This administration has done everything to undermine public health, whether it is instilling vaccine skepticism, whether it's changing the childhood immunization schedule, whether it's gutting the CDC, whether it's purporting that things like Tylenol cause autism. They've done harm, right? They've been harm both to public health and to our national security. So through a political lens, it would make sense to try to quell some of that. But still, there's still a big question mark. You still have RFK Jr. leading the HHS, who again in hearings in this past week was squeamish, right? He was squirming from the truth, and he continued to purport medical racism. So again, I am very happy. I'm very encouraged by Dr. Schwartz, but vigilance is the word of the day.
Dr. Purnell, I want to pick up exactly where you left off. I'm moving away from the vaccine conversation, and I want to focus on this discussion around Black maternal health, because it's been an issue. And look, I'm going to play an exchange that RFK had with Representative Summer Lee, and I want to get your response on the other side. Let's take a listen.
Do you have an idea of how we could solve the Black maternal mortality crisis if we can't stay Black?
President Trump is trying to end division in this country, not division.
Not eviction.
During the last 4 years. That's what DEI did. It divided people. It polarized people.
No. We're not talking about eviction. We're talking about health care.
I'm calling about DEI.
We're talking about health care.
Can you explain for viewers how problematic it is to sort of politicize the notion of race when talking about the disparities with respect to Black maternal health care and what an emergency it is in this country?
Yeah, let's make this very clear for everyone. Race is not a risk factor. Being Black is not a risk factor. It's racism. And this administration has been anti-Black in many of its policies. And you say, how can I say that? They have been anti-Black. They've been anti-human because they're seeking to undergird and undercut the things that save lives. We can't talk about being pro-life and you take away food benefits in SNAP. We can't talk about being for health and well-being and preventing chronic disease and you undercut public health research that allows us to have innovative solutions. Yet again, RFK has been on record fueling medical racism, saying black people have different immune systems. And of course, if you can't say black, you can't solve for issues that are disproportionately impacting black communities.
I thought that exchange, and it actually goes on for a little while. We only showed you a short piece of his conversation with Congresswoman Lee there. It was so interesting because he's not just saying basically that he doesn't want us to use the word black.
Yeah.
He's actually saying to use the word black, to name that there is a black maternal health crisis in this country, which is incredibly well documented and studied, is divisive. Divisive.
That's like saying being black is divisive, right? Again, the disparities that we see in healthcare, they arise because of differences in access to care, differences in quality of care, differences in life exposure. We know that systemic racism is contributing to lower life expectancy. We know that systemic racism and other ills, other discrimination, other biases, other inefficiencies are leading to a host of chronic health conditions that plague communities differentially, disproportionately. So he can say black maternal mortality, but the truth has already been written on the wall. And it's my hope that someone like Dr. Schwartz can bring stability, can bring credibility, and can bring sanity, but we've got to hold her accountable and hold the administration accountable.
One thing that RFK seems to have completely pushed aside that the MAHA camp finds very important is the embrace of corporate interest over banning pesticides like Roundup and banning different food colorings and additives. And that was an issue that really excited a lot of Americans, even if they weren't super MAHA, just because our food is so unhealthy. What do you make of just the abandonment of that agenda now that he is in a position of power and could actually do something to make our food healthier?
You know, I'm skeptical whether that agenda ever was really rooted in a desire to make Americans healthy, or whether it was more just the latest, whim in the wellness influence, regime and engine. Again, if we want to do the things that keep people healthy, we know we need a better food supply. But we also have to look at food deserts, food swamps. We have to look at SNAP benefits. You can't tell me that you want healthier food and you're cutting access to people who need it the most. The two don't add up.
Dr. Chris Purnell, thank you for being with us.